I knew you were going to smile like that. Okay, this is just the easiest way to update on everything that happened last night that brought me to the emergency room. At about 11 at night. Oh, what? Want some more? I laid in bed, felt fine, no acid reflux, no nothing. Ooh, I see a reflection on my glasses. That's going to try. Crazy. I'm not going to edit this. It's going to be all over the place. And so I laid down. I was tired. Obviously. Stayed up late. And I started feeling this twinging in my neck. Felt like my reflux was getting ready to start. I didn't think much of it. But then my mouth started watering. And it got pretty painful pretty fast. And I started feeling like I needed to take some baking soda, which always helps with my reflux. I just take it, wash it down with some water. You're going to distract people if you're doing that. You can sit with them. You can sit with me and tell them about what it was like for you seeing me like that, but don't do your toys and stuff, because then people will be like, who do I look at? Okay. So I took the baking soda, and usually what happens is you'll take the baking soda and you'll start burping, and the burps will feel really acidic. But it usually brings relief, and that didn't happen last night. I took the baking soda, I actually took like 3 spoonfuls, and oh no. Which one do you want, buddy? Do you want this or this? Do you want this or this? You want your binky? Good job, baby. I swallowed the baking soda, obviously, and as soon as it hit about right here, the pain just amplified by 100. And that was really weird, obviously. And then shortly after I took it, because I took another dose, like, that was weird. Maybe it's just really bad. And it's reacting extra strong this time because it's burning so much. So I took another one, and the same thing happened, except it hurt actually a little bit more than the first dose that I took. I'm already at 3 minutes and 16 seconds. I suck at making videos. I'll try and speed it up. So all of a sudden, I started feeling like, the best way I can describe it is like I was having an allergic reaction. I honestly thought that we were going to end up having to call an ambulance and that I was going into anaphylactic shock or something. It felt like my throat started swelling. It felt like kind of like those frogs, how they like blow out their neck when they rivet. It felt like my neck underneath here was just swelling a lot. It started to become a little hard to swallow, and I felt very strange, and the inside of my mouth got this really weird feeling to it, like I couldn't properly use my tongue. Okay. Mm-hmm. Or, and I just knew at that point that this wasn't normal reflux, whatever it was at the time, I didn't know. And then the next thing I know, I'm running to the bathroom, and I'm getting sick in the toilet. And I didn't feel any nausea, nothing. I just, all of a sudden, I was gagging. Threw up and just pouring saliva out of my mouth. My mouth just kept watering and watering and watering, and I kept getting waves of really, really bad burning pain in my chest and in my throat. And I had just taken my antidepressants before all of this happened. So I was talking with my husband, and I said, well, maybe it happened like what happened to you, which is you took your pill and it got stuck and opened in there and instead of your stomach, and that's what this burning is. And he's like, okay, well, I'll go get you a piece of bread. Brought me the bread. I took a bite of the bread. I swallowed it, and as soon as it hit right about here, just horrible pain. Only while it was passing, like this section right here. It would go down, and then just pain going from here all the way up into the right side of my neck. And I said, oh, that's really weird. Like, maybe it's caught in my throat. And so I took another bite, and it hurt again, except a little worse than the first time. And then I said, well, I mean, that's not right. I mean, I should be feeling some relief from what's going on. He's like, well, let's go get you some Tums, Is he leaning over a little bit?
Yeah.
He's trying to get your pants. Well, no, he wants your pants is what it is. He's wanting her pretty leggings. Show them your leggings. Show them your knee. Pretty flowers on it. I lost my train of thought. So he said, okay, well, let's try some Tums. So I chewed up the Tums really fast, and I took it. And I knew that I was going to end up in the emergency room as soon as I swallowed it, because the Tums did not help the burning pain, and it hurt even worse than the first 2 times that I swallowed it. And so we said, okay, if I swallow some water and it hurts just as... What? What do you want? Which one? You want your monkey? Yeah. Oh, good job, Bubba. Yes. Good job. Do you see something up there that you want to touch? Do you see a toy customer? What? You want to stand up? Sorry, guys. I know this is really distracting. And so I took a drink of water to wash down the Tums, and it hurt just as bad. Worse than the first 3 times that I swallowed something. And so I called my mom, and I said, no, look, we're going to have to go to the emergency room. And we ended up having to wake the kids at 12 something at night. Well, 11, almost 12. Hey, go up the pants. Yes. We woke the kids and basically rushed everybody out in their pajamas to the emergency room because I just kept feeling really weird. On top of the burning and on top of the not swallowing right, I just felt kind of strange. Do you want an apple? Yeah, you can have an apple. Can you stir the chili again, please?
Yeah.
Yeah, please stir it. And at this point, I have no relief from the pain. The pain's just getting worse. It's like a fist-sized hot poker in my chest and in this area of my throat. Why, honey? You're gonna be mad at me while I'm doing this? I see something. Oh, my goodness. Of course. Yes. And, so we get there, and I'm talking to the lady where you check in at, and all of a sudden, my face goes numb. Not like numb, I can't feel anything at all, but kind of like you get good and drunk, and you start feeling the numbness in your lip, and your nose. It was very similar to that, except my entire face. I found myself feeling like I needed to go, and scratching and rubbing at my face a lot, because it just felt really funky. My lips started tingling. I started getting that fuller feeling in my throat again. And I started feeling dizzy. So they didn't even triage me. They just took me right back. And talked to the doctor about it. And he offered me a GI cocktail, which is basically a mixture of like Mylanta, something else, and lidocaine. Which, I mean, worked like a charm, numbed me from my lips onto the inside of my mouth and all the way down my throat. And I did get some relief from the burning, but it still hurt to swallow, which I guess will be explained later. And he kind of seemed like he was only going to really address that. So the next time the nurse came in to like give me my actual cocktail, because the doctor was just discussing it with me, I said, well, I know he's addressing, the burning pain and stuff, but what about the numbness in my face? What about how weird I'm feeling? I feel like totally out of reality. I mean, I'm acting like I'm on something. My husband basically told me that I was acting like I was high. Just really weird. And so she said, I will definitely go out there and talk to him about that. And when she came back in, she said, he kind of feels like it might be from anxiety. And I was just like, I don't know about that, because I don't have anything to feel anxious about. I'm not really stressed out. I mean, yeah, bills and Christmas coming up and stuff, but nothing that would make me neurotic and... What? Well, you want to jump, huh? Yes, you are going to be the biggest distraction of all. Yes, you are. Oh. My little boy. Yes. It's going to be long. I'm sorry. Oh. Yes. So I said, you know what? Fine. I mean, that's fine. Yeah. I mean, what's the worst that's going to happen is I'm calm and I'm in pain. So got the Ativan, and much to my surprise, when the Ativan kicked in, all of the weird stuff went away. Like all of the lips tingling and hand trembling and feeling hot all over my body and my face feeling numb and weird. All of that actually went away. And I was very, very shocked. Because I didn't feel like it was my, anxiety. I didn't feel like I was having an anxiety attack. So after that, when the doctor came in, he said, that because the GI cocktail did work for the pain and stuff, I was going to follow up with my doctor just to get some more testing done, kind of the diagnostic testing that I need, not really what you would go to an emergency room for. And he asked me, how are you doing? Do you feel like you're going to be able to get some sleep? Because at this point it was basically almost 4 a.m. And I said, no way. There's no way. I'm calm, but I'm calm and in pain. I would be afraid to lay down. It's just lots of burning in my chest and stuff. So they gave me a shot of Benadryl in my honey. And once that kicked in, I was pretty loopy, really super tired, but really calm. I really liked the way the Ativan made me feel. It's not like Xanax. With Xanax, I just feel really ooh, and kind of frumpy. My mood is kind of frumpy and bland and blah, and I'm tired. And with the Ativan, I just felt calm and smooth, and there wasn't a big noticeable difference in how tired I was, or yes, handsome. Yes, give him a show. So I went to bed when we got home and decided that today we were probably going to do a walk-in with my doctor. Well, I got my coffee, and Matt let me sleep until about 10, because obviously we were up for hours last night, and I had a shot of Benadryl, which the pill knocks me out. The shot of Benadryl just I would not have wanted to be alone with my kids, because I probably would have been doing really weird stuff and not really paying attention to what was going on. And slept great, and I woke up and I felt fine. No burning, no pain when I swallowed, and I was just like, God, that's so weird. So I Skyped with my mom, because I had to catch her up on everything that was going on. And as I'm drinking my coffee and talking with her, I start feeling it again. I start feeling the burning, and just progressively, as I was talking with her, the burning picked up, and more my face started feeling weird again. And so I said, you know what? I have one Xanax left, and I know I'm going to do a walk-in, so I'm going to take my Xanax, and if it works, I'm going to be able to tell them for sure that I'm having anxiety attacks for no reason at all. Sure enough, I took my Xanax, and I'm fine. Like, I feel like a little bit in here, but it's more like leftover, kind of like, I don't know, just when you have a really bad headache, and then the next day you can tell where you had that bad headache. It's kind of what it feels like in my chest. So I talked with my doctor, and I told her everything that happened, everything that's going on, and I told her, I was like, I just don't understand. Like, I didn't feel anxious about anything, so why would I be having anxiety attacks? And come to find out, a lot of people who start having anxiety attacks have no explanation for why this is starting to happen. So she's prescribed me Buspar, and another thing that we found out was that my blood pressure's doing really weird stuff. When I was at the doctor's office today, it was 150 over like 90 something or 100, and I actually had a really, really bad headache because of it. And I've never had that happen before. I've never had my blood pressure be so high that I would have a severe headache. So we may also have to get that addressed as well. So I'm getting a few Ativan pills, just in case if there's ever an emergency situation like last night. I cannot even adequately describe how scary it can feel. It honestly feels like you are starting to suffocate. And found out from my doctor that a lot of people end up being really shocked at how severe your symptoms can be. People have even thought they were having a heart attack. And I guess it's going to be another long road of taking medication and trying to figure out what's going on, and I don't know. And just really quick update on Matt. We did find out that the reason why he is so sick is because his sinuses are completely full. They're so full that they're pushing back into, like, I mean, they're just way, way, way more full than they should be. And it's causing severe headaches, and he's got such a bad infection that he smells blood. And she looked in his throat, and he does have a ton of drainage. So stuff is draining down the back of his throat, and that's contributing to him feeling really terrible. He is on 30 days of Augmentin, and they usually only put you on for like 12 days. But his infection is so bad that they're afraid it's going to come right back. So now he's having to miss a lot of work, and Christmas is coming up, and it's been so stressful, guys. I haven't been on a lot, and I apologize for that. Huh?
Maybe I can do work for him.
You want to go do the iron work for him?
Yeah.
Oh, honey. Oh, I wish that we could do it for him, but it is very hard work, sweetheart.
If I could, I would.
I know. That's the same thing here. If I could, I would. I told him earlier today, I said, if I could take this away, I totally would. But now I found out I'm just a neurotic mess, and it is still partly my reflux, so they did give me medication for that as well. But if you guys have any more questions, you want to know any more specific, intimate details, just message me, especially if you're going through something like this and need somebody to talk to. I've been there as of last night. It's still very fresh in my mind. And, I do struggle with feeling like, why? Like, why is this happening? I'm a very strong person, and I don't feel anxious about anything. So why am I left feeling like I'm being weak? And, like, I know that doesn't make any sense because everybody can deal with something like this, but I still feel like I'm letting myself down a little bit. I don't like not being in control. But just remember, I'm still here. It doesn't matter what I'm going through. If you guys need to talk, just message me. I know there's at least a couple of women in our community that needs a lot more love than I do right now. I'm not going to say any names, but they've recently posted about significant life changes, and you know who you are, and I'm thinking about you and praying. No.
Preston's doing the iPad.
Well, you can do my phone or something, or you can hang out with me here in a minute after I get done with this. Anyways, let me know if you made it through the whole video. Oh, sweetie, I'm not paying enough attention. I'm sorry. And Asher says, hey. Hi, ladies. Hey, ladies.
And man.
There's mostly women who watch mostly women on Facebook.
Yep.
I probably left some stuff out. Again, my weight's been going up, and I have not increased how much I'm eating. Actually, I'm eating less. I have less of an appetite. And I went from like 202 to 211, which is crazy because I'm up all the time moving. I'm taking care of 3 kids. I'm eating 3 meals, not too much. And they're like mostly low-calorie meals, considering that I go for like the quickest sometimes. But I guess that's a whole other thing. Maybe we can get a group of women together who are experiencing some pretty tough stuff right now and just kind of be there for each other. But just message me, guys. Talk to me. Comment on my stuff. And we'll keep in touch and just really try and build each other up through all this tough... What? What? Hmm? Hmm? Ooh, the face. Freddie's tired. Okay, I'm going to stop rambling now. Bye, guys.